Yeah.
So, Mr. Chairman, HR 676, you're the man behind that. Have you been able to convince more of your colleagues about the merits of your bill, sir?
You say, have I? Yes.
Yes.
Well, we're now up to 85 members that believe in single payer. Last month it was 60-something. The month before it was less than that. And the amazing thing is that more and more members are coming to this as they listen to it. So that's the beauty of what it is we're doing. It makes sense. And as soon as, and that's why this rally is important. The more people, the more members that know that there are more and more people coming to this position, it makes it easier for them to come to this position. And that's the whole idea. That's what the rally is about. Is waking up our colleagues to understand that we know what's going down. And reading a 1,000-page bill is not what's going down. I mean, first, that's so silly. You can read 1,000 pages. If you don't understand it, you're no better off than if you never looked at it. And the wrinkles in this bill are not mysterious. We're modifying the public support, the option for public option is being modified and compromised. They tell me that's going on in Waxman's committee right now. The Senate has already announced no public option, period. Well, then what are we doing? We're facilitating the insurance company industry even more now. By now making it a law, you gotta get registered for public insurance. You gotta get insured even if you don't have any money, and we'll pay for it ourselves. Well, our way, a universal health care plan says you don't have to register to say you can't afford it. It says you're in from the beginning, you're in, period. And that's the big difference. The other thing that we say that I haven't heard being said by anybody else is that health care in a democracy is a matter of right. It's not what the companies want to give you or what your employer feels like or anything else. Roosevelt started talking about that. Truman talked about that. Johnson talked about that. Kennedy talked about that. And more people are realizing, why do I get cut off or kicked out because there's a pre-existing injury? I didn't cause the pre-existing injury. I didn't know I had one. But that's a convenient way of getting rid of people that may be sick and need health insurance. Is that, hey, you were sick before you got here and you didn't tell us and you violated the rules. Goodbye, we're dropping you. And I was just talking with some people from Connecticut that they want their Attorney General to examine I think it's Aetna, that are dropping hundreds of thousands of people in her state. And what can they do about it? They say, look, we took you in, we can kick you out. And of course it's pretty obvious that the more healthy people you have paying insurance and kick out all the people that are sick or likely to get sick, hey, guess what? More profits for the company. Because to them it's a business. It's not a matter of treating the sick, it's really a matter of getting rid of the sick and make sure that they don't come into our system. And if we get them in, guess what? Drop them after they get in by one of the many techniques that Michael Moore and people that have worked for insurance companies have already pointed out.
Okay, thank you, Mr. Chairman.